Side voice.
It's Dr. John and Dr. Brooks with Des Moines Spine and Sport, and another Movement Monday video. This week we're back with another abdominal strengthening series. Last week Dr. John highlighted the dead bug series, and this week we're going to take a look at the front plank.
Alright, so check out this abdomen strengthening protocol.
So we're taking a look at the front plank. I really love the front plank because it's an opportunity to basically develop a foundation for strength. Because the plank is a static position, we're developing strength in that good, solid, stable lumbar spine position, and I think that's important to develop there before we integrate more complex and dynamic movements. What I want to highlight here when I drop to the ground is I'm going to show the two most common faults that I typically see with the front plank, and then I'm going to show you basically like a derivation or a modification of that movement for those people that are really having some difficulty finding that stability in that lumbar spine. So we're going to work to the ground here. So typically what I'll see with regards to athletes that are struggling with this position, they'll fall into one of two faults, okay? They'll either be up in a teepee-like position where hips will be too high and we basically round in some lumbar flexion, or they'll be in a sagging position where hips fall and we're in an extended lumbar spine position. We want to be in an almost tabletop-like position where our back is flat and we're neutral throughout that lumbar spine. What I just showed there was a hands and toes methodology. That's basically the highest progression and the most difficult position that we can be in with regards to this front plank. The modification for that would be from the hands and the knees. So once again, we want to maintain that tabletop position, avoiding sagging and avoiding that TP. So shoulders on top of the hands, maintaining that good neutral lumbar spine position. What I'll have my patients do with regards to this front plank is they need to show me that they're able to stabilize and maintain this position for at least 60 seconds before we progress to some more dynamic and complex abdominal strengthening procedures. That wraps up our front plank. Once again, it's a great place to start with regards to building some of that abdominal strength, some of that abdominal facilitation, but not necessarily the place that we want to finish. Most of us don't live within a static environment. We're dynamic beings. We get up and move. So we need to be able to create lumbar spine abdominal stability dynamically as well. Take a peek at our upcoming videos as we'll start to outline and introduce some of those more dynamic movements. If you hadn't had a chance, go ahead and check us out on Facebook, YouTube, Instagram for more of our Movement Monday videos.